Good evening. Thanks for coming this evening, and we're going to get started. So I get the privilege of introducing our speaker. We have a small group today, which is nice. It makes it a little bit more informal as well. So feel free to speak up if you have any questions. As you know, this is the third of five-week series, and I'm just going to remind you of the next week is what's new in atrial fibrillation, and the week after is below the belt, an integrative approach to abdominal complaints. So I get to introduce Dr. Scott Chudnoff. Received his undergraduate Bachelor of Arts degree from Yeshiva University in New York. Went on to medical school at UMDNJ Robert Wood Johnson. And also completed a Master's of Science with distinction from Albert Einstein School of Medicine. So after graduating from medical school, completed a residency in obstetrics and gynecology and women's health at Albert Einstein College of Medicine. Subsequently earned his sex counselor certification from the American Association of Sex Educators, Counselors, and Therapists. And finally completed his training with a minimally invasive gynecologic surgery fellowship at Montefiore Medical Center, Albert Einstein College of Medicine. Dr. Chudnoff is a current chair of the Department of Obstetrics and Gynecology at Stamford Hospital, and as I've mentioned in the past, like most of, I think all of our speakers, is nationally recognized in research as well as recognized by our local organizations as a top physician. So, welcome.
Thank you. So, given the size of our crowd, we'll make this a little bit more of an intimate discussion, if everyone chooses so, rather than such a formal lecture. But the truth is that this is a topic which I think is something which is fairly underrated and is not really addressed head-on frequently. Other than maybe in magazines and a variety of other online sources. But typically most physicians don't typically get up and talk about these topics. And unfortunately not enough doctors talk about these types of topics in regular patient interactions. So what I'd like to do is quickly go through a review of sexual anatomy, some physiology, and then talk about a couple of common problems that people frequently experience and some things that we can possibly do, some easy solutions for some of these problems. So I always start out talks like this with a very basic definition, because I believe in using accurate terminology when we're talking about stuff. And throughout the talk I'm going to primarily use medical terminology. I stay away from slang as much as possible. But I always start out with this question. What is sex? Seems like a fairly simple question. I think most of us probably have an idea of what we think this answer should be. Anyone want to take a stab at what they would answer?
Gender.
I'm sorry?
Gender.
Gender, right? So are you male or female? Any other possibilities?
Intimate genital contact with another person.
Okay, intimate genital contact. That's probably these are probably the two most common things you would hear. You would hear the word sex. It would be one of those two things. Anything else?
Reproduction.
Reproduction. So I can tell you that if you were to go and poll 100 people and ask them for their definition of sex, which has been done, what you'll get are probably about 50 different responses. And particularly if you start asking people about what is sex. And again, it's not uncommon to have a confusion about what is sex, because you mentioned about gender, right? That's the first thing that pops into your mind. You mentioned about intimate genital contact. But it is possible that sex can encompass a whole slew and a variety of other activities. I think that we're well aware of the fact of the definitions of what sex is can sometimes be a little bit different based on how we personally view it. And my general feeling is that if the past president of the United States can have different definitions than maybe the legal definition, then I think it's something which is worthwhile for us to talk about. And so the reason why I talk about that is because it's important for us to know what our own biases are when we talk about topics as it relates to sex. We all come in with certain predispositions, kind of these biases of what we've learned, we've brought up with, our experiences, and ultimately we all have different views towards what is sex, what's normal, what's abnormal, and so on. So I always like to also do a very quick review of anatomy before we talk about anything as it relates to specifics. You know, when it's new couples, it's even more of the case, but you know what I found out? Doesn't matter whether they're new couples, whether or not they've been married for a long time, whether they're in new relationships, old relationships, the amount of misinformation about normal anatomy is enormous. So let's start out with this one. What's the biggest sex organ in the body? Anybody want to take a guess?
The mind.
The mind, yeah, good. Right? The mind is probably the biggest sex organ in the body. It's interesting because when I say it to younger crowds, I get different answers, particularly to the men in the room. We'll dispel that myth in a little bit. So the brain is definitely where sex begins and where sex ends. Everything is really governed by the mind, by the way we think and what we think about. And what we also know is that the way that the male brain and the female brain function are very, very different from each other. The fact is that this was a study that was done. It's called a functional MRI study. And in this study, basically what happened is a person was put inside an MRI machine, and they looked at what areas of their brain lit up when they were exposed to different things. And in this particular circumstance, there was men and women both put into these MRI machines, and they looked at their brain and they showed them certain sexual pictures. And what you could see is, let's see if this works, is actually the parts of the brain that light up and the way they light up between a man and a woman are actually different. And that's because males and females process sexuality in very different ways. So it's fairly obvious when you look at these pictures that you could actually see. You don't need to know anything about medicine to realize, though, that you see over here, it's all lit up over here. The woman, it's lit up on both sides over there, right? I don't think anyone will argue that women probably use more of their brain than men when it comes to sex. So let's talk about sexual anatomy, like I started. So basically, the male genitalia is pretty straightforward. The penis is essentially a shaft, and the shaft itself is essentially a sponge. The sponge fills up with blood, and that's what causes an erection to occur. And at the base of the shaft, down over here, you can't really see it in these images that I have up here, there's basically a rubber band that seals off the sponge in the penis, and so what happens is the penis fills with blood, the band closes up, and that's what causes an erection to occur. Below is the scrotum, and inside the scrotum are the testicles. Interesting fact is the fact that the testicles do move. It's part of one of the ingenious designs to the human body that the testicles are actually located outside the body because the male body is too warm to support the sperm, and they would die if it was actually located inside the body. The temperature would be too high. And actually, the testicles will lower and raise based on the heat and cold that they're exposed to because of the fact that, that depending on whatever temperature they're exposed to. I think the perfect example could be demonstrated by if a man ever jumps into a very cold pool, the testicles will rise up very quickly. And in this picture, you could kind of see the rubber band a little bit, not really, it's a little bit deeper. But basically, this is a cross-section of the penis, and the penis has a center tube called the urethra. That's where both urine and semen come down through. And the reason why urine doesn't come out during sex is because the bladder, which is located up here where the urine is, has a little thing that gets closed off at the time of sexual arousal when the penis is actually erect. So I always like to give a little bit of the what's normal stuff because I think people always have a big misconception about what's normal. So the average erect penile length is about 5.1 to 5.7 inches. That's about yay big. Okay. The average circumference is about 4.9 inches. It's about that wide around. Just interesting fact that the human penis is actually larger than any other primates comparatively to the rest of the body. And males typically, believe it or not, underestimate the size of their penis, and that's typically related to the fact of where they see and how they see it is. And when it comes to sexual satisfaction, women tend to be more concerned with the width of the penis rather than the length of the penis because of the stimulation of the outside portion of the vagina, and we'll get to that. It's normal for the penis to have a little bit of a curve, but if there's a lot of angulation to the penis, that can be a problem and can cause some difficulties. And it's normal for one testicle to hang lower than the other and for one to be slightly larger. So now we move on to the female genitalia. And in the female genitalia, the outside portion over here, this is called the labia majora. And those are basically the large lips of the vagina that typically stay closed. When a woman's had a baby before, they tend to be open slightly afterwards. There's the labia minora, which surround it, which are these thinner lips over here. And when the labia minora reach on the top and connect, this is the covering of the clitoris. The clitoris is this organ right underneath here. The clitoris is almost identical to the penis in as much as that it gets erect when stimulated. But unlike the penis, it doesn't have a rubber band at the bottom of it to keep it erect. So the clitoris will stay erect if there's stimulation, and if there's no stimulation, it will shrink down in size. And then this is the opening to the vagina over here. This is the urethra that urine comes out through, and this is called the perineum, and down over there is the anus. And this is a cross-section, and what I will show you is as follows. So it's hard to understand the anatomic stuff sometimes, but basically if you can imagine that this is a woman lying flat on her back. Her head is over here, and her feet are over here. And imagine she's cut right down the center like this, straight down, and we're looking from the inside out. And basically what we see here is, so this is her uterus over here, this is the vagina, this is the urethra and the bladder, and this is the rectum, okay? The reason why I show this picture is not to give everybody an anatomical lesson in internal anatomy, other than the fact to see, though, the vagina actually heads at a 45-degree angle backwards when a woman is lying down. Why is that important? Well, that's important because if we're talking, and again, I apologize, I always talk about what's called heteronormal relationships. I focus on that because it's easier for the purpose of the talk, but it can apply in other types of relationships. But assuming that that is a male partner with insertion of the penis, if you don't realize about this angle going down like this, and you try to insert the penis straight, what ends up happening is you hit this right over here, the bladder. Okay? And that can cause a lot of discomfort and pain for some women, particularly if the angle is not going in the right direction. It's a frequent cause for people to have pain during intercourse if that is happening. And it's no different than if a woman was having a urinary tract infection and you could traumatize the bladder. So what is normal? So again, there, believe it or not, has been less research about what's normal for the vagina than the penis. I guess that probably shouldn't surprise anybody. The vagina does change size and shape throughout the reproductive years. It starts out smaller, it gets bigger throughout the course of the reproductive years. It peaks in length somewhere in a woman's 20s to 30s, and then after menopause it starts to get smaller again in caliber. And there are multiple factors that could affect the dimensions of the vagina, the age, the number of children, the way that she delivered her children. Vaginal discharge is something which is normal unless there's a particular foul odor or significant itch to it. And the other thing is it can change in color or amount both throughout a woman's life as well as even within a regular cycle for a woman who's menstruating. And natural lubrication is produced in the vagina through a sweat mechanism. So some people think that most lubricant is produced by glands, and there is some which is produced by glands, but the majority of lubrication that happens during sexual arousal happens through a mechanism where blood flushes the vagina and pushes water into the vagina. It's essentially sweating into it. And lubrication can be influenced by a whole slew of different things: sexual arousal, age, pregnancy, menopause, nursing, any types of drugs, and a variety of medical conditions can all impact the amount of lubrication someone has. So moving along, so we got past our anatomy lesson. I'm going to get through the physiology lesson, and then I promise we'll get past the science stuff and get to the stuff that's more practical. And so basically when we talk about sexual physiology, though, there's really three aspects to it. There's the physical, which relates to the biological components, how things are physically working in the body, and mechanical, how they're interacting during relationships. There's psychological, and then there's the actual relationship itself. So when we talk about what normally happens during the sexual response, this was done by some of the original researchers, Masters and Johnson. They were not married. They were researchers. They were married to different people. They got divorced. They married each other. They were married for a while, and then they ended up like 40 years later getting divorced themselves. Just as interesting historical point. But they came up with this idea here. How does it work when someone's involved in sex? So there's this arousal phase, excitement phase here that happens, and that's based on whether or not the person is being stimulated. And if the person continues to have stimulation, they will eventually hit an orgasm. It's possible to have multiple orgasms. And then there is this part called resolution, where everything sort of goes back to normal and everything heads back to its regular phase. And this actually is very good for describing what happens typically for a man. It's actually very poor at describing what happens with a woman, because with a man, it tends to start here. There's stimulation, excitement, and boom, you move through, and then resolution, everything goes back to normal. For women, it's definitely much more complicated in terms of the cycle. And it's not important to see all of the details of this. I put it up there just so that you can see the difference in terms of understanding what's involved for sexual arousal or stimulation for a woman is much more complicated than it is for a man. Now, this is something which I think is really fascinating, because I don't think most people realize this. When a woman is aroused, and throughout the entire sexual response, her internal organs change in size and actually move. Not unlike a male, where the penis gets erect and changes in size. And I think it's fascinating, because I think most people don't realize this fact. What happens during excitement? Lubrication starts to pour into the vagina through this sweat mechanism that I mentioned to you. The vagina starts to actually swell, and the uterus does something called tenting, where it actually changes direction, and it starts to point backwards, and that's what helps to make the vagina actually expand over there. During orgasm, what ends up happening is the vagina actually contracts in a pulsatile fashion, and interestingly, the pulsatile fashion moves towards the inside of the vagina. Presumably, evolutionarily, it was intended to pull the semen inside to help for fertilization to occur. And then subsequently, there's the resolution, where everything else goes back to normal. During that process, the vulva, the outside lips of the vagina, actually fill with blood as well, and that partially works to act as a cushion. Also, during orgasm, the uterus itself can contract and can start to dip into here as well. Right? Most people probably did not know that. I never knew that until I studied it, and that was already after 4 years of medical school and 4 years of residency. And so this is our end of our physiology part of this. And I just want to talk about something very quickly called the sympathetic and the parasympathetic nervous systems. Everyone here may have heard of this before at some point, but basically, what are the two different, these are two different nervous systems that govern the way our body, all of our functions work in our body through either the sympathetic or the parasympathetic nervous system. And the interesting thing about these nervous systems are, when one is on, the other one is off, and vice versa. They both don't activate simultaneously at the same time. So what is the sympathetic system? This is what's known as the fight or flight. And so what is this? So basically, imagine you're walking down the street and you suddenly come across a tiger. I don't think there are too many tigers in Darien, but I could imagine other types of stresses that we may come across. And you have two options here when you see that tiger. You're going to do one of two things. You're either going to fight and say, I'm going to try to kill this tiger, or I'm going to try to run away and get away from this tiger. So it's either going to be one of the two. If you sit there and say, this may be a good time for me to have relations, you'll probably get eaten by the tiger, right? That's most likely the response. And it's incredible that our bodies have this hardwired into us, because that protects us from something bad happening to us. And there's relevance to this. I'll get to it in a second. And the parasympathetic system is what's called the rest and digest system. And the reason why this is important is this is what allows our body to recuperate and recover after things. I liken it to this. Imagine you just finished Thanksgiving dinner. And that sensation that you just want to lie down on that couch and not move, right? You ate an enormous big meal, and that sensation of I just want to sit, that's the parasympathetic system. So why is this all important? Because when the sympathetic system actually is what governs whether or not an orgasm occurs or not. The parasympathetic system is what governs whether somebody is going to get aroused. So you need to first relax in order to be able to get aroused, and then you need to be able to activate the sympathetic system in order to be able to have the orgasm. So why is that important? Like I said, only one can be active at any given time. So we're probably not going to encounter too many tigers, but many of us have lots of stressors in our life. I know for myself, in-laws are typically a stressor for us. But I'm sure that everybody has their own stressors, whether it be jobs, or your children, or your neighbors, or any slew of different things. Everybody's a little bit different. And so therefore, what ends up happening is, if you are under an undue amount of stress, what will happen is that you will not be able to get aroused because your parasympathetic system is going to be turned off because your sympathetic system is on. Your body's ready to fight. Vice versa, if you take certain medications, particularly if you're drinking a lot of alcohol, that's a depressant and will prevent the sympathetic system from activating, and that's why some people may have difficulty having an orgasm if they're under the influence of a variety of different substances. So I'm just going to show you this. Let's see if this works. This one video, which I put together from the Discovery Channel, which is that.
Corner of the body. Heart rate changes. The diameter of your breathing thresholds
There we
go
go.
way up. You don't feel pain.
Better?
Blood pressure goes up.
The inner lips of the vagina enlarge up to 3 times their size. The vaginal walls engorge with blood. During intercourse, the mons pubis cushions the pubic bone, and the only organ made solely for sex, the clitoris. When aroused, it swells with blood, just like an erection. Nerve endings in the human body, 8,000. Twice as many as the head of the penis. The skin flushes with sweat. The vagina has no sweat glands. As its walls enlarge, the pressure is so great they exude beads of moisture, lubrication for the penis. Perhaps because her contractions make the back wall of her vagina dip into the pool of deposited semen. It starts with the brain. When we're aroused, it triggers the release of nitric oxide.
Now we're talking about what happens in the man.
Gas, but just as potent. The penis is made of spongy muscle tissue, squeezed tight. In fact, a limp penis is actually tense. Muscles also line the blood vessels running through the spongy tissue. Then the nitric oxide arrives. The muscles relax their grip, letting blood rush in at 50 times normal speed. The vessels expand, filling out the spongy tissue around it. Result, erection. The more erect the penis, the more relaxed its muscles actually are. The smaller a penis is when limp, the longer it'll grow. On average, it takes 70 days for sperm to reach maturity. Now they travel past glands that contribute the ingredients to make semen, nourishment, lubrication, and a coating against the acidity of the vagina. Poised for their journey, they'll be fired by a muscular trigger. The trigger lies deep in the pelvis, tiny muscles like coiled springs waiting to be stimulated. The lower spine gives a long-awaited order. Release the pelvic trigger. Pelvic muscles convulse, bringing the sperm. The vagina contracts in bursts of ecstasy. It's true.
So I thought that was a semi-decent illustration of just the normal physiology of what actually happens. And so this was an interesting study that was done, the National Survey of Sexual Health and Behavior. And the reason why I point this out for people is to realize that, like I said, a lot of people have expectations of what they think is normal and not normal and what people are doing, particularly based on age. And what I think was fascinating was, contrary to what many people believe, people in 70 plus were still actively engaging in masturbation. About 13% of men and 5% of women were still reporting active partnered sex. And the truth is that you don't have to go, I mean, that's at 70 plus. Between 60 to 70, the numbers are significantly higher. 60% of men are masturbating and 40% of women. And the fact is that people are still very, very active sexually into much later years of their life, which, again, I think is surprising because most people automatically assume that as you age, that you're just not going to be sexually active. And I think it's very important for people to realize that it is totally normal for that to continue. So, as I mentioned, men and women are very different. And if we start to think about some of the issues and problems as it exists, it's important for us to differentiate a little bit between the two. And so if we think about a man, right, and you think about what it takes to get a man going and excited, and then we think about a woman and what it takes to get her going and excited. And as you can imagine, it's definitely much more complex for most women than it is for most men to be able to get the system working properly. So what are some of the most common complaints that we tend to see? With women, it tends to be this decreased desire or arousal, or difficulty with orgasm. For some women also, there could be a big issue with pain and discomfort during intercourse. For men, the two most common ones are premature ejaculation and erectile dysfunction. So in terms of arousal, and specifically decreased arousal and desire, so what's interesting is the differences between men and women in this process. I think that the general view of sex and sexuality and what our expectations of what a partner would or wouldn't want is very different. So what are some of the causes for why this can happen? It could be something which is physiologically going on inside our bodies. It could be a medical issue. It could be a physical problem, discomfort, pain. It could be a relationship issue. And it could also be something psychological, depression, anxiety, all these things play into it. And there's a whole bunch of life cycle factors that come into play too. Pregnancy, postpartum nursing, menopause, all impact what's normal and what's not. So just quickly to go through some of the things in terms of medical. So high blood pressure can have an effect, diabetes, vascular disease, a whole slew of different types of medications can impact it. In terms of physical, a variety of disabilities, including arthritis, limited mobility, can have a major impact. Back pain, obesity, deconditioning. And then in the relationship itself, the fact is that stress and discord, unhappiness, the ability for the partner to be able to perform properly. And this is a big problem we see a lot of times with couples. If one of the people in the couple is not able to perform well, the other person may actually start to experience dysfunction secondary to the fact that their partner was able to perform adequately. Along with disappointments and also differences in expectations. It's interesting, I'll mention quickly about differences in expectations. I did a survey probably about 11 years ago now. And I surveyed 200 couples on a variety of different things relating to sex and sexuality. And I asked them, how many times a week do you typically engage in sex? And these were couples that were between their 20s and 40s. Almost all of them were college graduates. Many of them had graduate degrees, variety of professions. That's just to get an idea of who I was talking about. And what was interesting is when I asked them, so how many times a week do you have sex? So the men answered on average 2, and the women said 4. Now these are the same couples. So clearly there's a little something going on in terms of that discordancy about why is it one is viewing it differently. And it was interesting, the differences in the views that the women and men had. A big issue relates to body image. And body image is a major component when it comes to sex, because being confident with your own body is very important, because if you start getting anxious about the way your body looks, then that will start to activate that sympathetic system that I mentioned, and it'll turn things off. Psychological, depression, anxiety, like I mentioned, body image concerns. And like I said, it's related primarily to this fight or flight type of situation. The more that you're stressed out, the harder it is to get aroused. And then the other thing that's important to keep in mind, there's something called Maslow's hierarchy of needs. Our bodies have a certain need to do certain things first, basic things. We need to breathe before I need to worry about eating. I need to be able to know that I'm safe before I'm going to really start to engage in a relationship. The highest, obviously, in this, and again, I'm not going to get into the whole psychological model of this, but ultimately what we see is that you need to feel that your basic physiologic needs need to be met. You need to be fed. You need to get sleep. In order to be able to get into a relationship and be able to enjoy the intimate parts of that relationship as well. So, what could be done? So the best thing is first identifying what the problem is. And there can always be multiple factors about why there's a problem. And I'm a big believer in taking a multi-pronged approach to these things. When it comes to low desire, we look at all of them simultaneously. We look at the physical, the psychological, the relationships, the medical and physiological, just to make sure everything's working well. Now, we live in an age of immediate gratification. We like everything to automatically be fixed for us. And we live in an age where if I have an issue, just pop a pill and we'll make it better. Unfortunately, it doesn't work as well when it comes to sexual arousal. And there's a lot of components to it. We know that hormones play a major part of it. We know that estrogen and progesterone and testosterone are the three main hormones involved. We know that people who, when there's a higher testosterone levels, that can help with sexual activity and sexual arousal. Low levels can impact it and make it negative. Not enough estrogen or progesterone can also impact it. But for women in particular, but men also, the idea that you're just going to pop a pill in order to be aroused really does not seem to work very well. And so there are a whole bunch of new medicines on the horizon and different ways of treatment that have been looked at. Estrogen, giving testosterone therapies. There's a new medication for postmenopausal women called Osphena, which is very helpful for women who have vaginal dryness. And it's not your typical hormonal replacement therapy. It works directly in the vagina. There are several other medications that are out there. And then the first drug that really has been approved for low desire, sexual desire in women, is called Addy, which is limited in terms of its benefit, but it is out there. And there's a whole bunch of other drugs which are currently in development because everybody is still looking for that magic pill. But I think it's important to target the physical problems. Weight loss, exercise. Exercise is one of the most wonderful things you could do. It helps with mobility. It helps with blood flow to the pelvis. It can increase a sense of well-being. And the other thing is increased sleep. Most of us probably don't sleep well enough. And that lack of sleep can really be a big piece. Communications is always a major component in any relationship. And I can tell you that invariably in most relationships, there are always issues as it relates to communication. And the fact is that what actually everybody needs and what it is that helps them get going is something which is really, underplayed frequently in that communication process. Outside of the bedroom, I always say, it was interesting, when I was training, so I don't know if anyone in here remembers Dr. Ruth Westheimer. So Dr. Ruth, famous in really starting, the public idea of sex education and sex knowledge and sex wellness. And she's a fascinating woman. She's all of about 4'7". When she sits in a chair, her feet don't even hit the floor. And she liked to say that that two things. First of all, she said that if you think that it's going to start once you get into the bedroom, you're wrong. The other thing she always said was, always remember before you walk into the bedroom to leave your baggage at the door because nobody else is going to come and steal it. And so one of the big issues is that we have to remember that there's a long process of this buildup towards a fulfilling sexual relationship, particularly when it comes to arousal. If we expect that it's going to turn on and off like a switch just when you walk into the bedroom, that tends to be something which doesn't tend to work so well. And then the last thing is the ability to change things up. I think that when people become overly familiar with each other, we sort of fall into these trends of we just do what comes to us naturally. There was a study that showed that couples that are together for more than a year do the exact same thing 95% of the time. So the ability to switch things up definitely helps with interest. So I'm going to switch gears now and talk a little bit about orgasmic dysfunction, and I don't think there's any better way to talk about this than with this clip.
Well, what do you do with these women? You just get up out of bed and leave?
Sure.
Well, explain to me then. What do you say?
Just have an early meeting, early haircut, early squash game.
You don't play squash.
You don't know that, they just let me.
That's disgusting.
I know I feel terrible.
You know, I'm so glad I never got involved with you. I just would have ended up being some woman who had to get up out of bed and leave at 3 o'clock in the morning and go clean your andirons. And you don't even have a fireplace. Not that I would know this.
Why are you getting so upset? This is not about you.
Yes, it is. You are a human affront to all women, and I am a woman.
Hey, I don't feel great about this, but I don't hear anyone complaining.
Of course not. You're out the door too fast.
I think they have an okay time.
How do you know?
And how I know.
Because they...
Yes, because they...
How do you know that they're really...
What are you saying? That they fake orgasm?
It's possible.
Get out of here.
Why? Most women at one time or another have faked it.
Well, they have faked it with me.
How do you know?
Because I know.
Oh. Right. That's right. I forgot. You're a man.
What was that supposed to mean?
It's nothing. It's just that all men are sure it never happened to them, and most women at one time or another have done it, so you do the math.
You don't think that I can tell the difference?
No.
Get out of here.
Oh.
You okay?
Oh. Oh, God. Ooh. Oh, God. Oh. 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 Oh, God. Oh, yeah, right there. Oh. 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 Oh, God. Oh, yes. 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 Oh. Oh, yes. 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 Oh. Yes. 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 Oh. 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 Oh, God. Oh.
I'll have what she's having.
So when Harry Met Sally, I think, is probably one of the more classic clips as it relates to that. And, you know, I think there's a lot of myths that surround orgasm about what it is and how it happens and so on and so forth. Now, I don't want to get too far into here. What I'd like to do is, since we're already getting close to the to our time limit here, is if there's, I'll pause for a minute, if there's anything that anyone wants to discuss specifically, I'm happy to address any of the particular areas or topics. Otherwise, I can continue going. But if there's something in particular in one of the areas that I brought up, or in terms of one of the dysfunctions, I'm happy to skip to that part of the talk. I know, it's a small audience, which makes it even harder for people to want to say anything. All right, so then I'll go through just this one section over here. So basically, let's talk a little bit quickly about orgasm. So what is it? So for most people, believe it or not, most people are able to know what an orgasm is, but at least 15% of women report that they have no idea whether or not they have or have not ever had an orgasm. They don't know how you get one. They're not sure if they've ever had one. And for women in particular, orgasms are based more on clitoral stimulation as opposed to vaginal penetration. We know that 50% of women are incapable of having an orgasm through vaginal penetration alone and needed clitoral stimulation. There's this idea with relationships that they need to happen at the same time. That's a very big movie-esque type of thing. And then also the need to have it in order to be able to enjoy intercourse. And I can tell you that this is one of the biggest myths that men have about orgasm, which is that if a woman is not having an orgasm, that means she doesn't enjoy sex. And actually, every study out there has shown that well over 90% of women say that they are very happy enjoying sex for what it is, even if they've never had an orgasm during the course of the sexual activity. Because again, that difference between what men and women view as necessary. It doesn't mean that a woman should not have one. It doesn't mean that she will definitely enjoy it if she doesn't have one. But for many women, it's not necessary to have one. I can tell you that in my own practice when I see sex therapy patients, that one of the things I'll hear about is a guy will sit there and say, I spend 45 minutes, an hour, and she's still not doing it. She's like, I was happy stopping 30 minutes ago. And that ability for them to be on that same page. So know how to get there. And for women, it really, a lot of it depends about knowing themselves. Like I said, I think that most women don't have a very good understanding of their own anatomy. And if you don't understand your own anatomy and how it works, it's very hard to be able to get there. The ability to be adequately aroused is very key. Sometimes if an orgasm doesn't happen during the course of intercourse, if that was intended, then you need to continue to have further stimulation even afterwards. There's a bunch of different devices, and also understanding positions. One of the most important things for a woman being able to, and for a man as well, being able to achieve an orgasm relates to focus. If you're very distracted, if you're thinking about the fact that I have a doctor's appointment tomorrow and I need to take my car to the mechanic, and 6 other appointments that I have to do while you're engaged in sex, you're probably not going to have an orgasm because it requires you to be able to relax enough. And there's something which is called sensate focus exercises, which is something which I teach to patients frequently, which basically involves get an awareness of your own body and that ability to say that, I'm able to figure out what type of touch is something that you enjoy. And what I always stress to people is that enjoyable touch doesn't necessarily have to engage the genitals. There are many parts of our bodies that we enjoy having touched that can be quite arousing that have absolutely nothing to do with the genitals themselves. And there's a whole process of that you go through in order to be able to get there. Kegel exercises are another big thing for women to be able to contract the muscles of the pelvis and to get a better awareness of those muscles that are in the pelvis. And I'm going to really go out on a limb here and talk about vibrators. Vibrators, this actually is an advertisement, you can see here. This was back from 1920, something, I forgot exactly the date. And what you see here is actually the normal history of gynecology. What the man who's there is actually a gynecologist treating his patient for hysteria. And the vibrator was actually created as a medical device because the male gynecologist's hands would get too tired in treating their patients for their hysteria. And so the vibrator actually required a prescription for the until about the 1930s, 40s, when it started being sold to the public in general. And so the other thing is positions are very important too, and certain positions may be better for people than others in terms of being able to hit the right spots, and also for comfort's sake as well. A lot of people have they may be uncomfortable in one position or another, and the ability to choose different positions that are most comfortable for you are very likely to be a big piece of it. I can talk quickly about premature ejaculation. So, what is it? The average time for a man to ejaculate takes approximately 2 to 5 minutes from the time of penetration. Anything less than that would be considered clinically premature. And it's normal for men to experience this at different parts of their life. It's typically most common after a man has not had relations for a very long time. And there's a bunch of things that can be done for it. Things like numbing gels. Viagra and injectables tend to not help so much with premature ejaculation, but can help for somebody to be able to have a second time of intercourse, so they can ejaculate. And usually the second time around, if it's easier to achieve the erection, then it's also easier for them to be able to last longer. And then there's also something called a particular class of antidepressant drugs, which can also help. And then there's just pure old training. There's something called the start-stop method, where the man stimulates and then relaxes and stimulates and then relaxes. And then there's the one that I tell people to use very, very, very carefully, called testicular traction, where basically when the man feels like he's about to ejaculate, that you gently pull down on the testicles. I always say, be gentle. Otherwise you can really have a very bad evening. And then there's also something called the squeeze and release technique, which basically allows for you to just squeeze the penis very tight, and that can prevent ejaculation from occurring, which can also allow it to last much longer. I'm going to stop here. Does anybody have any questions or anything that I can answer for anybody?
Is sex therapy more of a going concern nowadays?
In terms of?
In terms of couples, in terms of singles?
It's a very common, it's very commonly sought today, because again, I think that there's two factors at play. It's an education thing. I'll give you a perfect example. I had a young couple who were having difficulty with their sexual relationship, and they were having discomfort, that things weren't working well. So the guy comes home one night with a whole bunch of handcuffs and whips and chains, and his wife subsequently flew out of the house because he went on the internet and he found some article somewhere that said something about improving your sex life. And that's what he saw, and he actually went out and bought this stuff. Now again, a little bit, I wouldn't recommend that for most people, but that's part of the issue. But definitely sex therapy is become much more acceptable today.
Mainstream.
And yes, definitely much more mainstream than it used to be. Again, a lot of it relates, like anything else, to, going to people who are, licensed to provide it. But yeah, it's definitely much more mainstream than it used to be.
Could you talk a little bit about differences in desire
Sure.
in partners?
So you mean in terms of one partner having greater desire than the
Yeah.
other? So that is one of the more common things you hear about in relationships, that one partner, there's what I call discordancy. There's one partner who may have a lot more desire than the other. And there's a lot of factors at play with that. It's interesting, as Viagra came out, what happened is we used to see this natural waning of the sexual relationship that would happen somewhere in the late 40s, early 50s. And it kind of all coincided well. Men would develop their hypertension and become obese and would have erectile dysfunction issues. And women would get into menopause and would naturally have this decreased desire. And it's interesting, I've seen people talk about it, no one's actually really written this paper yet. But what happened is with the advent of Viagra and all of these other medications where men are now capable of achieving erections where they may have normally waned, and the relationship may have been for a very long time. So what you end up happening is now suddenly you have one person who's very interested and one person who's not. Now that's one particular example. There are many cases where one person may have a lot more desire than the other. The question there is really, is there a specific problem or not? And in most cases, it's not. In most cases, listen, I like vanilla and someone else likes chocolate. I want 2 hamburgers and you only want 1. We all naturally have different needs. And the same thing applies in relationships. The problem is when it really develops to that level of what I call dysfunction, where it's interfering in the normal functioning of that relationship. And it doesn't function normally because one person may be totally disinterested and the other person may be hyper-interested. And it goes on both ways. Usually, I recommend when people are in those circumstances that usually begins with communication and talking about it and explaining. Most people don't have frank discussions about sex and sexuality. And it's one of those things I always encourage people. I think it's important. There's no reason not to discuss it. We'll talk about so many other things. Why not discuss it with whoever is going to be your partner? And part of it is setting expectations. A lot of times people get frustrated because they expect that things are going to work a certain way. And they expect that. And the other problem we have is we usually think that the other person feels the same way as us. So if I want a lot, I'm assuming that they want a lot too, right? Why wouldn't they? I want it, they want it too. And we sort of project our own feelings onto someone else. And that ability to even just enlighten your partner and say that can be very helpful.